All right, let's pick up with a question that we had come in asking us to explain a little bit about modifiers, the global package, and bundled services. This is a lot of information in one question. So when we start to talk about these, a lot of times you're going to hear the phrases global surgical package and bundled services. When you hear those things, basically what's happening is the insurance company is wrapping all of the services related to a specific procedure into the payment for that one CPT code. So while there may be several CPT codes that could be broken up to represent the different pieces, they say bill us the big one and we're going to bundle everything in there. So sometimes things are bundled, and sometimes they're bundled into what we call a global surgical package. Now these surgical packages, there are different types of surgical packages. We've got your major surgical packages and your minor surgical packages. Those all differ based on the number of global service days. So think about the procedures that they're having performed. If a patient has a major surgical procedure, so think about anything from restoring an open fracture, right? Lining the bone back up, closing that hole that was created when the bone popped through the skin, to removing organs. Maybe a patient had a hysterectomy. Those are major surgeries. They oftentimes take a long period of time to heal, well beyond 10 days. And they have what's called a 90-day global package, which means for 90 days, everything that that surgeon does is bundled into that major surgical package, right? All those follow-up visits, anything that's related to the surgery gets bundled in. That's kind of a shortened version of what a major surgical package is. I did include some links. Lorraine, if you can scroll just a little bit farther. They're down here below. I included the links to the Medicare website that show you the difference between major and minor. Okay, so I talked about major being major, 90 days. Minor is 10 days. It can actually be 0 days or 10 days. And again, those are going to be procedures that don't take quite as long to heal. And the difference between a 0 and a 10-day is going to be what all is being performed. Things like scopes. Think about an upper or colonoscopy. Those usually have a 0-day global because you're only going to see the patient that one day and everything you do that one day is going to be included. That's considered a 0-day global. But maybe you had to place sutures in a laceration. That's probably going to have a 10-day global period because that skin has to heal and you've got to see the patient back in 7 to 10 days to remove those sutures. That's all considered part of that surgical procedure of repairing the laceration. The other type of surgical package that we have, and it's not really a surgical package, but it's another type of package that we see, and that's the obstetrical package. A lot of people kind of forget that this is another packaging or another bundling. So when we talked about major surgery and minor surgery, we were talking about a procedure that was being performed and all the services associated with it were lumped in. We talk about the obstetrical package, we're talking about a patient who's pregnant. And all of the care related to the pregnancy is lumped in to what we call their obstetric package. Now, billing for an obstetric practice, or I'm sorry, an obstetric package, not an easy thing for me to say tonight, is a little bit different, and each carrier has different rules. The link that I gave you here is actually a link to ACOG, the American College of Obstetrics and Gynecology. A lot of the stuff on their site is pay only. You have to be a member to get it, and you have to be a physician to get to it. This is one of the free articles that they put out there. And they actually talk about when that package begins, and it begins when the confirmation of pregnancy is documented. So it bundles all of these things together, and you're going to see if you look at the CPT codes specific to the OB package, that typically that OB package includes 13 antepartum visits. You know, anything before the baby is born. It includes labor and delivery, and it includes the follow-up care with mom, right? You're probably going to see her for a day or two while she's in the hospital before you discharge her and let her go home. And then you're going to see her back 6 weeks after delivery to make sure she's healed okay, baby's acclimating to the household, mom doesn't have any major postpartum issues that we need to deal with, all of that. That's another type of package that they've bundled that payment together. Now, so surgical packages were one piece. Bundling is another thing. Surgical package include bundled services, but sometimes bundling is simply saying this procedure is part of this bigger procedure, right? Maybe when I go in and I do, let's say I do a partial colectomy, right? If you go in and do a partial colectomy, you're removing part of the back, depending on which part you remove, there may be a specific part to say, oh, I did just the sigmoid colon, or I did just the transverse colon. But if you do multiple pieces, there's a larger code that you can use in place of the one that says, oh, I did this piece and this piece. Okay, that's what we call bundled. It says you can't bill them separately. Now, sometimes they bundle things together that are usually performed together. And if they're performed separately or they're not integral to one another, that's where your modifiers come in. Modifiers are used to unbundle packages, right? To unbundle surgical packages, to unbundle the obstetric package, and to unbundle bundled procedures. So if you scroll up a little bit farther, or I'm sorry, scroll on a little farther, I do give you the link there to the NCCI edits on the Medicare website. If you're not familiar with NCCI, this is the National Correct Coding Initiative. This is what Medicare uses as their basis for determining which procedures are bundled with one another, which ones can be billed together, which ones can't be billed together, and which ones can be billed together if we use a modifier. This is actually a nifty little document that takes you through how to use the database of NCCI edits, what the different pieces mean, because when you put in two codes together, you're going to get them that show up one right next to the other. They explain what a column 1 code is, what a column 2 code is, and you've got little numbers next to it, a 0, a 1, a 9, and it explains to you, you know, if it has a 0 there, that means you can't ever bill those two procedures together. They're mutually exclusive. It's one or the other. If it's got a 1, it means, oh, well, sometimes they go together and you might need a modifier to unbundle them. That sort of thing. So they give you, like I said here, you know, an example of the difference. If you have a 0, you cannot put a modifier on it. It's not allowed. You can't unbundle them. It's not going to happen. A 1 means you can put a modifier on it if it's appropriate. The 9 means modifier is not really applicable. It doesn't have anything to do with that. So they take you through all of the different pieces. Well, if you go back to the answer sheet, we're going to talk about which modifiers affect bundling and the packages. There's lots of different modifiers that may unbundle certain services. Now, the first two I talk about are modifiers 24 and 25. 24 and 25 are E&M modifiers. They can only go on your evaluation and management code. These two cannot ever go on a surgical procedure. These go on the evaluation and management. 24 says, hey, the patient was here, but I saw him for something completely unrelated to the surgery they had done. I see this a lot in family practice. Maybe we have a patient who's pregnant and she comes in for something unrelated to the pregnancy, right? Maybe she has an ankle sprain. It has nothing to do with the fact that she's pregnant. We're not seeing her for the pregnancy today. She sees your OB for the pregnancy. We're seeing her to follow up on her ankle sprain. Oftentimes that's a modifier 24. Say it's unrelated, totally separate. 25 is used for some of those minor surgical procedures that it's decided we're going to do it today after we've already seen them for an E&M. Maybe we saw them, they came in for an office visit. We didn't know we were going to need to do a minor procedure. Minor procedure could be anything from a lesion removal, right? A laceration repair, those types of things. Again, the documentation has to be clear that it was separate, but a 25 says, hey, it's separate and we can pull that E&M out separately. The last 5 modifiers are all surgical modifiers. These would go on your procedure code. These usually fall in the 10,000 to 60,000 series of CPT. These modifiers, the first 3, 54, 55, and 56, are used to break up the surgical package. Maybe your physician is the surgeon, but he or she is only doing part of the care, right? Maybe somebody else did the pre-op and the post-op. They're only doing the surgery itself. They bill that CPT code with a 54 on there. Said, I just did the surgery. That's all I need paid for. Don't pay me for the pre-op and the post-op. If they only did the post-op, they're only seeing the patient after surgery for all that follow-up, you use a 55. If they only did the pre-op, you use a 56. Now, it's important to say these are the coding rules. Every payer is a little bit different. For example, Medicare really doesn't like that pre-op modifier and doesn't recognize it in a lot of situations. So you need to be familiar with your carrier rules if you're using these from a billing perspective. 57 and 59 are 2 additional ones that you see. 57 says that we made the decision for surgery today. 57 is also an E&M modifier. Put that on the E&M code to say that the service we provided today is separately reportable from the surgery because, yeah, we're going to do surgery today or tomorrow, but we just figured out we needed to do it and decided to do it today. And the has to be clear to say, we made that decision during today's encounter. 59 says it's a distinct procedural service. This is what unbundles two surgical procedures from one another. And this is one of the biggest abused modifiers. People think, oh, I get an NCCI that says these two don't go together, and I have a 1 says I can put a modifier on it. Just because you can doesn't mean you should, right? They have to be separate. There has to be something different to use that 59. Oftentimes it's a different surgical site, right? Maybe it was an arm and a leg. Maybe it's a different surgical session. We took them to surgery in the morning, we took them to a different surgery in the afternoon. But there's got to be some distinct service there. There's got to be a separate piece before you blow those apart. So just to recap, packages, general global surgical packages could be either a major surgery, a minor surgery, or an obstetric package, and those bundle together payment for the type of procedure the patient received. Bundling is not limited just to packages. Sometimes CPT codes, one CPT code is bundled into another because it's a more extensive CPT code. And modifiers are used to break apart those packages or those bundled services. So that's kind of a synopsis of those three different concepts.